Our chief guest, PS Broadcasting and Telecommunication, extinguished guest, and all protocol observed. Good afternoon. I'm Dr. Veronica Buto from Kitengela Sub-County Hospital. I'm here to share with you a case study of digitization in a health facility to show you that it is doable and has as a health facility, patients and healthcare, we can embrace the change and move on. First of all, I'll go to introduction. Kitengela Sub-County Hospital is a level 4 hospital in Kajiado County, bordering Machakos and Nairobi County. We have a very high patients workload with a coverage of 60,000 population. On a daily basis, we see up to around 700 outpatient and inpatient, and the hospital also has both inpatient and inpatient. So first, I'll take you through the journey of implementation. Implementation of Afya KE in our facility was done in phases, and we did this so that we can be able to address the change management issue. First of all, we went to the county leadership. We had a meeting with the county leadership where we did a presentation and sensitization. After that, we started with change management at the facility level. This one took some time for about 2 weeks, where we engaged the health management team at the facility level. We had a series of meetings telling them the importance of digitization and how it's going to benefit the patient and give them a great experience in offering their services. After we are done with us, we did deployment and configuration of the system. We were lucky as a facility that before the implementation, our infrastructure was a halfway. The health IT, with the help of health IT, we had cabling which had already been done. So as a facility, we were supposed to buy end user equipment, which we did. And we want to thank our county government because they allowed it and approved a budget. Though it was expensive at the initial cost, but the benefits is going to outweigh the cost of implementation. So as you see the framework, on 29th of November, we went live after the dry run on 25th. So the Afya KE system in our facility is end-to-end. It covers the inpatient and outpatient complete. It's paperless. Even in the maternity, it's paperless. Even the cardiacs, everything we do is paperless. So as you see, the key characteristics is end-to-end, patient-centric, operational at the facility, multi-tenant, which means this system can be installed in our facility and other facility. And it is role-based, meaning that each and every healthcare person can only view what they are supposed to view. If you are at registry, you only view registration. If you are a clinician, you can only view clinical notes of the patient. So we go to what made us succeed as a facility, because as you've heard from most of our presenters, change management is an issue. First, it was the support from MOH and Kajiado County government. When we were doing sensitization, the healthcare workers were told digitization is the way to go and there is no option, and in case you don't want to change, you will be transferred to another facility. I'm sorry it was like that, but it had to be like that for it to be achieved. Then also another thing, the system was user-friendly. So it motivated the health staff to adapt to the system. So I'll go to the benefit of the Afya KE to patient. That is one of our patients there being seen by one of our clinicians at the photo. So the Afya KE system has markedly improved the patient experience at our facility. This is due to various factors. There is improved quality of care. There is convenience, like one of the presenters said, You don't need to carry papers around. It is paperless. You only have to carry your ID every time you come so that you can be activated in the system. This has also resulted in reduced turnaround time, and also the cost of care has also reduced on the patient side. Wanjiku don't need to always carry the results of the X-ray and the lab. And there's no way you'll be told that, Mama, your results are lost, go and do another test. So this one has also improved. Then it has also improved the trust we have with our patients because there is privacy. There is privacy of the data. You can only access to the data when you are an authorized person. What are the benefits of this system to our healthcare? I'm also a healthcare worker. I'm a doctor in the facility. What are the benefits of this system to me? The system has made us to improve the care we offer to our patients. This is because we save a lot of time. We don't need to do writings, and we only have to click on the patient and identify, and you are going to see all the tests you've done to the patient, all the visits the patients are done in the facility at various points. It has also helped us to reduce duplication of services. And another thing which this system has also helped us a lot is decision making. The system is web-based, which means that even if I don't have a computer at the facility, so long as I have a smartphone and I've installed the system, I can always consult with my colleagues. And I don't need to give all the history of the patient. I'll only give the name of the patient or the unique identifier, and my colleague will be able to help me make a decision and support the patient. So that was, the graph you see is at the workload, which has also increased in our facility due to the installation of system. This one can be attributed to good capturing of data, compliance in reporting, and it can also be attributed to many patients coming to the facility due to efficiency. So we also narrowed down on the benefit of the system to the facility as a whole and the county government. The governor has told us that there are many projects which are being run by the county government, and finance is the key. So this system also has made us improved in our collection. The first time we installed the system, as our facility, we were collecting 1.5 million. When we installed the system, the next month we collected 3.4 million. And our graph has been going up in collection. So the digitization of healthcare, however, it is costly at the initial implementation, but you will find that at long run, it will be an advantage to our government and even to service delivery. Another advantage also is commodity management. As a government facility, I know we always have issue with commodity management where there is a lot of wastage. The system has an inventory, so all our commodities, when we receive them and dispense, is through the system. This has made us to really reduce the cost we use in commodities every day. And we can even ascertain the amount of drugs we used, where they have gone. So we also had challenges when we are doing the system implementation. And one of them was infrastructure. As we are told, you need internet connectivity, you need end user equipment, and you need stable power. So in the infrastructure, what we did, with the support of the county government, we were able to get end-user equipment, internet connectivity. We were able to contract a private provider, and now we have two, so that when one goes down, the other one can be used. Also, we had a challenge of basic digital literacy. When we implemented the system, for our part, we used to have workers who even refused to look at that computer. They told me, Daktari, I'm not accepting it. Some even have to force their fingers to type because they are saying they have never used a computer and that is the first time they are using. So it was a great journey, but being persistent to change and having the vision, we were able to manage. So my take is that as we do the digital health bill, and also for our health workers, we must insist on digital literacy, basic digital literacy, to enable us realize the implementation of digital health. My take-home note is that it is doable, and as healthcare workers, we will embrace it because it improves our work and gives us a lot of time to be able to serve our patients better. Thank you so much.
I'm so sorry. Thank you very much. Give her a round of applause. I'm so sorry. I'm also working on the concentration of your audience because of the time.